As doctors and medical students, it's important to understand the concept of patient autonomy and how it is important in healthcare practice. Patient autonomy is a fundamental principle in medical ethics which emphasizes the right of the patient to make decisions about his or her own care and treatment. It acknowledges that patients have the ability and capacity to make informed decisions regarding their treatment options, including refusing to accept medical intervention altogether. Patient autonomy is essential for many reasons. First, it promotes respect for individual rights and dignity. By allowing patients to make decisions about their own care, doctors can acknowledge the patient's right to self-determination and personal freedom. This fosters a more equitable relationship between healthcare providers and their patients. It also enhances the quality of decision-making. When the patient is involved in the process of decision-making, they can provide valuable insights into their own circumstances, preferences, and values. This can lead to better decisions that align with the needs and goals of the patient. Lastly, it encourages shared responsibility for health outcomes. By empowering patients to make informed decisions about their own care, doctors can approach healthcare in a more collaborative manner in which both the doctor and the patient share the resulting consequences, whether good or bad, in the decision-making process. So how can a doctor apply patient autonomy? A doctor may choose to apply patient autonomy in many ways. Before any medical treatment or intervention occurs, doctors must ensure that patients understand the risks, benefits, and alternatives involved. This is called informed consent and allows the patient to make an informed decision about whether or not he or she wishes to undergo a particular treatment or procedure. Doctors should also involve patients in discussions about their care. By taking into account the patient's preferences, values, and beliefs, the doctor and patient can work together to arrive at the most optimal decision for the patient. This is called shared decision making. Patients also have the right to refuse medical interventions, even if they are recommended by healthcare providers. For example, let's examine the case of a 65-year-old male patient with advanced lung cancer who has decided not to undergo chemotherapy despite his doctor's recommendation that it could improve his chances of survival and the quality of his life. The patient is aware of these potential benefits, but believes that the side effects will be too severe for him to tolerate, and so he has refused treatment. In this case, patient autonomy is crucial because the decision about whether or not to undergo chemotherapy should ultimately rest with the patient. The doctor could have an open conversation with the patient and discuss the potential benefits and risks of chemotherapy in detail. In addition, the doctor may also explore alternative treatment options that might be more tolerable for the patient if such treatments exist. Respecting the patient's decision, even if it differed from what the doctor may have chosen, should be upheld. Let's take a look at another example. A young woman with a history of depression has been prescribed antidepressant medication by her psychiatrist. However, after doing some research online, she found out that the potential side effects have caused her great concern. She now prefers to try therapy instead, but she isn't sure if this is an option suitable for her condition. Patient autonomy is crucial in this situation, especially when the patient is aware of potential risks and benefits associated with these different options. Therefore, The medical professional could start by discussing the information that the patient has found online and address any concerns or questions she may have about the antidepressant medication. In addition, they should then explore therapy options by explaining how it works, its potential benefits, and any associated risks. By providing a balance of information and involving the patient in the process of decision-making, the medical professional can guarantee that patient autonomy is upheld while still meeting the patient's mental health needs. In conclusion, understanding and applying this principle of patient autonomy is very important in medicine, as it promotes respect for the rights of the patient, enhances the quality of the decision-making process, and encourages shared responsibility for the outcomes of the patient's health. By using this principle in your practice, you will be better equipped to provide high-quality care that aligns with the patient's needs and values.